What do we mean by transforming the organization digitally?
Our community is changing very fast. In terms of risky behavior, how people meet friends and partners.
Innovation is about being creative and finding ways to maximize opportunities.
To have innovation, you have to understand our diverse population.
Geosocial networking is the networking system using geolocation techniques like geocoding and geotagging to increase an interaction dynamics. So you can find local people or local events to match your interests. So geosocial networking apps have become an indispensable part of gay social life in the 21st century, or even more so during the COVID pandemic when social distancing is mandatory. Social networking app market is constantly evolving. Some are emerging, growing, and exploding like supernova, like Twitter, and some went dead, like Tumblr. So many GBSM social networking apps are trailblazers for HIV education and prevention. Functions like voluntary disclosure of HIV status, reminder of regular HIV testing, and providing information regarding local community drop-in centers, U=U, PEP, PrEP, or Chem6 harm reduction messages.
The community-based organization, or the CBO, is a basic component of public health. Data shows that it has been magnificent in increasing our reach in HIV. First, CBOs improves health-seeking behavior. Outreach-based awareness campaigns have improved communication between the patients and their healthcare providers and encourage better healthcare decision-making. The COVID pandemic has forced many of us to actually move online. And in a way, there's a silver lining in this because we are now thinking of more innovative ways to provide our services. Many of the awareness efforts of our community-based organizations are now online. Lectures on combination prevention campaigns are broadcasted on YouTube and streamed on Facebook Live. Conversations are held mostly via audio on Twitter Spaces.
The APCOM team would say they're most proud of the Gay OK Bangkok series. First episode reached nearly 2 million views.
It's really two things. It's a message and it's a movement to make sure that that message gets out to the public. And the message is very clear that people living with HIV, when we're on treatment and we have an undetectable viral load, we cannot pass on HIV through sex. So let's look at what a successful U=U implementation looks like. There's really three basic components. One is the advocacy part. The second is communication, and the third is education. First, advocacy. So what is this all about? This is about really institutionalizing U=U from the very highest levels in a country and globally. So making sure that U=U is integrated into official guidelines, strategies, policies, and communications. Also communications. So how do you say U=U? What are the ways to get this out in a way that's not just accurate, but is also going to be meaningful and authentic for people affected and the general public. Now, education. So it's really important. U=U is new. It's new information. It's still radical. So we need to offer opportunities to teach people how to communicate U=U and why U=U is even important to communicate in the first place.
We are NGOs that connect with the community, with the medical services, because we think that being a bridge is quite important in Taiwan, that because people want to have service, but they don't know where to have it.
So it's important that the organizations and the leaders and the researchers that are all working together on this stick together and continue to share what we're doing so we can learn from each other and continue to really change what it means to live and to love with HIV around the world.